Hi students, I'm Una.
And I'm Scott.
I'm a UK OET teacher.
I'm also an OET teacher from the UK.
We've been teaching students to pass their exams for many years.
And now we're excited to help you pass your exams too.
This is the Swoosh English OET Podcast.
Let's get started.
Are you struggling with your OET exam preparation?
Are you unsure how to reach your target score of a grade A or B? Let Swoosh English help you get there.
Go to www.swooshenglish.com or click the link in the description for your free OET Complete Guide to Writing.
Everything you need to know to pass your OET writing step by step. Go to www.swooshenglish.com or click on the link in the description below.
Hello everyone.
Hi.
And welcome to the Swoosh English Podcast, here with myself, Una.
And myself, Scott.
Okay, so today we are going to get into the OET exam and we're going to look at the OET writing task. So of course that is writing a letter, whether it be a referral letter, a discharge letter, an advice letter, for a fellow professional, for example. And a lot of students do have difficulty with this task.
Well, it's writing, for one. Everyone loves to write letters, especially
That's sarcasm?
It's sarcasm. It's a bit of sarcasm. It is obviously quite a technical task as well, given that it's a letter that is very different to any other form of academic examination, given that you have to closely mimic and replicate a professional letter that you would write in your own profession, but also being tested on your ability to convey accurately in English.
Exactly. So that's really important as well. Overall, your general language skills, your grammar, your vocabulary, that is really important to consider in this
Organizing
exam.
your layout, your tone, your ability to extract essential information and convey it in a nice, logical and organized way.
Yeah.
So there's a lot going on in this task and it can feel quite overwhelming. So what we're going to do today is we're going to break down this task into manageable chunks. We're going to obviously go through a bit of the overview, like we already have a bit, go through the scoring criteria for this task, and then go through the method, what you have to do, as well as some information and tips that you can do to hopefully put it all together on the day of the exam, and also in your on the preparation that you're going to have before you actually do it.
Yeah, definitely. We'll just give quite a general podcast on this writing task. Okay, so what exactly is the OET writing test? So we've talked about it a little bit, but of course it is a letter that is profession specific. So if you're a doctor, you're going to have a letter suitable for a doctor, a nurse,
physiotherapist, psychiatrist, dentist, etc. So most of you watching this podcast today are probably doctors and nurses.
It is the most common.
It is, of course. But don't worry,
test.
of course, if you're not a doctor or nurse, you will have a letter type that's relevant to your own profession as well.
And you will be presented with a set of case notes, which are, of course, typical and practical of your profession and generally easily understood and laid out quite clearly for you.
Which will replicate your own profession as well in terms of the information that's been taken down in someone's file. It's up to you to look at those case notes, analyze them, extract the key information, and then put them into a letter in full discursive English.
Yeah, it's very important to pick out the correct information that needs to go into that letter. It's really crucial in terms of getting a high score.
And also, the kind of letter that you are most likely to get is a referral letter. So you are obviously referring this patient to maybe another profession, the same person, or maybe someone of a different profession. So you have to look out in terms of what information you have to convey. Other types of letters that you may get as well are advice letters and discharge letters. But referral is the most common, so we're going to base our podcast around the referral letter type today.
Okay, so whenever you go into the exam, you have 5 minutes to read the case notes and then 40 minutes to actually write your letter. A further 40 minutes to complete the letter. So overall, your tone should be informative and professional throughout that letter.
Yeah. Relevant to your own profession as well. For example, a doctor may write differently to a nurse might write differently to a pharmacist, etc. So it needs to be relevant to your profession as well as being professional as well.
Definitely. And overall, the main idea is to communicate what the issue with the patient is and what you want the reader of the letter to do about it.
So communication and purpose is very, very essential to this task overall. And also we have to recommend as well that obviously you may be an expert in your given field. You know, okay, this patient's got this condition and this condition. I know what to do about this. Please only stick to the information in the case notes.
Exactly. Yeah.
Don't bring in other outside medical knowledge. You're only being assessed on what is in the referral letter or anything else that you bring in outside will actually be detrimental to your score.
Yeah. So don't bring in any outside information or knowledge from your own experience. You're just using the case notes and putting them into that letter. So just remember as well that although this, of course, isn't actually a real letter that you're writing, the OET test is supposed to be a simulation of reality.
It has been designed by genuine healthcare professionals.
Yeah, it's under real conditions. They've used real conditions and real scenarios in order to give you a situation which you may have come across or which you definitely may come across in the future.
So it needs to be as close to a real referral letter to a real professional in the healthcare field as possible. That's what we need to do.
Yeah, exactly. It wants to be a very close simulation to a professional letter. Oh. And of course, the professional nature of your letter is super important, but as is your overall language skills. So you need to display a good balance between professional, your professional language, and also your English efficiency as well.
Yes, remember, this is still predominantly an English language test, so you need to put English at the forefront of your abilities in this writing task.
Yeah. So should we have a look now at the actual criteria?
Yes, let's have a look at the scoring.
And of course, you can find the criteria on the OET website, and it's a really good idea to really understand what you're being marked on within your letter. It's crucial.
So what we're going to do now is just basically go through a brief overview of the criteria and give our assessment on what the criteria is and what you have to do well in order to score well on them.
Yeah.
So there are 6 different sections of criteria. We have purpose, content, conciseness and clarity, genre and style, organization and layout, as well as language. So they're all scored very differently as well. Purpose is scored from a scale of 0 to 3, while the other 5 are scored on a scale of 0 to 7. So please keep that in mind. It doesn't mean that you should ignore purpose. Purpose is still highly essential.
Very important.
So let's start by looking at purpose overall.
Yeah, so purpose is whether the reason for the letter is apparent from the start and developed throughout the course of the letter. So you're going to refer to the purpose at the beginning and then expand upon the purpose or what you want the doctor to do again at the end of the letter. Yeah. So, as we said, purpose, making sure that the reader of the letter goes away with a good idea of why you were writing and what they have to do with the patient.
It's just essential for communication, right?
Yeah, exactly. It makes sense.
Exactly why they're writing and what can be done about it. So that's why there are 3 points for that overall. And it comes at the very beginning of your criteria too. Next then, we have content. So that is pretty much developing upon the purpose. Obviously, with the purpose, we want to ensure what the information needs to be known. But the content is extracting that information from the case notes and including the relevant information in order to achieve that purpose. So there's going to be a lot of different information in the case notes. Not all of it's going to be relevant. It's up to you as writing the letter to understand what information I need to include and how can I include that relevantly and purposely inside the letter.
Whether the required information in the letter is accurate for the reader and there's not repeated information or, as you say, information that really isn't that relevant to the letter and doesn't really put them in any advantage as to knowing that information. Right. And ultimately that really, you could say, conciseness and clarity, which is the next criteria.
Which kind of joins on.
Yeah, it comes into that too, because if you're giving information that isn't relevant, well then are you really being concise with your word count? And a lot of students find that actually it's very difficult to stick to that, 200 sort of word limit, 220 word limit. They always end up going over that.
So yeah, as Una said, the letter needs to be between 180 and 200 words. And although OET does not actually penalize you directly for going under or over the word limit, if you do go under or you do go over, then this is the one area of the criteria that may be affected.
It's your conciseness. Yeah, if you're writing too many words, well then are you being concise?
Are you including too much irrelevant information? Are you expanding upon it too much and the letter doesn't flow? And as we say, there's no real clarity and conciseness in your answer. So you want to make sure that you have an effective summary of the reader for the reader, and also you don't omit essential information or include any unnecessary information overtly and focus on that too much.
Yes, definitely. And a really good way, although you want to make sure that, of course, with your letter, in terms of your genre and style, which is the next criteria, that you're being polite with your tone and everything, you don't want to end up using too many words by being overly polite.
Oh, yes.
Yeah, and really going over the top, because that is actually using up your word count as well. It would be greatly appreciated. Do you need to say greatly? No. It would be appreciated.
No, I know most British English speakers, Australian English speakers, American English speakers, etc. are all very, very polite in our culture, but there is actually
you can be
there
over
is
the top.
a limit for being over the top, especially when it comes to basically.
Yeah, so think about your word count in that sense as well.
Mm-hmm.
So genre and style is, of course, whether the register, tone and use of abbreviations are appropriate for the reader.
Mm-hmm.
So you really need to consider when it comes to abbreviations, does the person understand, or acronyms even, like does the person understand those acronyms? Who are you writing to?
So that ultimately depends who you're writing to. Obviously, if you're writing to a fellow doctor, for example, you're a doctor writing to another doctor, then you can probably include a lot of those abbreviations because the person is of a similar medical field to you and therefore they have an understanding. But would you use these acronyms when communicating to a physiotherapist, for example? You probably wouldn't because they wouldn't understand what you're talking about. So therefore, the content and style is actually dependent upon also the information you're trying to acquire and the information you're trying to give to the associated healthcare professional, as well as the purpose of your letter as well. So that all is dependent on that.
So then we have our organization and layout. So whether the letter is organized well and laid out for the reader in a clear way.
So it should be structured throughout. Now, of course, the structure of the letter may depend on who you're talking to, as well as the patient's case notes overall. But you want to ensure that purpose is there, the medical history is there, the summary of the patient's previous care, as well as obviously the outline about what you want the professional to do. Those are the 4 simple sections you should focus on overall.
Definitely. And then your language. So of course that's the accuracy of the grammar, vocabulary, spelling and punctuation communication to communicate necessary information to the reader of the letter. So just considering, overall your language use here.
Think about what tense you have to use. Obviously you're going to be incorporating a lot of different events over different periods of time for this patient's ongoing healthcare. Are you using tenses correctly? Are you able to use modal verbs to express exactly what you want to express in terms of the information you're given, etc.
Do you use any passive voice?
Passive voice, for medications, for example.
Exactly, passive. And like you say, the tenses are really important. And then another mistake we see a lot are the use of articles, the use of articles and prepositions. So really, if you think that is something you're struggling with, get lots of practice with that. And of course, you can work on your spelling by simply, practicing the spelling. If you're not comfortable with the spelling of a word, whenever I used to have to learn spelling words for learning a language, I would just write the word out like again and again. So whatever it is works for you to improve your spelling. And then of course your punctuation, especially when it comes to the likes of compound sentences and complex sentences, we can see a lot of comma errors.
A lot to consider.
Yeah, so that is our criteria.
We hope we didn't overwhelm you there with the criteria. As we said, we just wanted to give you a brief overview of the criteria today. But please keep it in mind whenever you are doing your sample letters or even getting some feedback as well, so you know exactly what you do well and what you can improve on as well. All right, so let's now get into the letter writing process itself. So the first thing you should do in the day, like in the real OET writing examination, you have 5 minutes at the very, very beginning. You shouldn't start writing. You shouldn't necessarily start planning as well. Or you shouldn't necessarily start writing your plan, should I say. You should start analyzing the case notes.
Yes, that's
overall.
The first thing you have to do with those 5 minutes.
I mean, because if you don't have a good understanding of what the case notes are, then you can't necessarily write an effective letter.
You're going to be going into it in the dark and you're going to make mistakes and leave things out. So we'll just go through a number of steps that you should do, the first things that you should sort of analyze and consider.
Yeah, so the most essential things that you have to really consider, of course, is who is the patient? What are they suffering from?
Identify the pain health issue.
Identify the main pain health issue, because there will probably be a few health issues in the case notes. Who you're writing to. Is it another doctor, for example? Is it a nurse? What information will they need to know? Also establish if the case is urgent or not.
Yes.
Are they actually undergoing a serious health issue? So do we think this is urgent or not? And that's obviously important for the continued care of the patient.
Definitely, you consider the urgency of it and highlight that pretty early in the letter. Are you struggling with your OET exam preparation?
Are you unsure how to reach your target score of a grade A or B? Let Swoosh English help you get there.
Go to www.swooshenglish.com or click the link in the description for your free OET Complete Guide to Writing.
Everything you need to know to pass your OET writing step by step. Go to www.swooshenglish.com or
So then depending, and that's of course depending on your profession, if it's going to be urgent or not. Then imagine you're writing directly to the other professional. Think about what he or she needs to know. Yeah, so think about that most essential information in that letter, what they need to know.
So that will obviously be dependent not only on the patient's current condition, but also of the profession of the patient or the other referral healthcare professional in relation to your own situation as well.
Yeah, so quickly scan through the notes. You do only have 5 minutes, not a long time. You want to scan through those notes and highlight anything that is really relevant and cross out anything that you think is irrelevant.
That can be very distracting as well when you're going back. You might obviously see all the information again. You might think, I've forgotten what information is essential. So make sure you organize that in a clear way. Obviously, a highlighter pen is essential, or even a red pen. It's good just to make it look very obvious on the page for you before you actually move on to the writing process.
Yeah, definitely. And cross out or underline the things that are important, cross out things that are not important. And so then what are we going to do? We're going to think about the logical way to start to order that information as you look through the case notes. Think about the reader when you do this. What would be the best way for you to organize this information in order for the reader to most easily understand that letter?
Yes, and that can depend on the letter as well, but we make sure that we obviously organize it in a similar way each time, which we'll get into very soon.
Definitely.
A final thing you can do in the planning stage as well is also just numbering the information as well. So pick out the information on the case notes. Think, okay, this is the patient's main health condition. I'll put 1 or 2 beside that. This is what they've currently been undergoing in terms of the care. I'll put a number beside that. This is some extra information I think is important for the relevant healthcare professional. I'll put a number beside that. And then you can obviously put that information into a logical flow in your writing process. That's a really good tip.
Yeah, to put numbers down on that on the case notes. Really good idea. Okay, so that is analysing the case notes. So then, now you have the 40 minutes will start to begin. You could start writing straight away, right?
Absolutely not.
Why not?
Because how have you planned this letter appropriately at this point?
Well, I planned it in my analysing of my case notes.
Well, you may have obviously understood what information you need to include at that point, but now you need to actually put those case notes together and think about how you can put it into a nice, formal, structured letter.
Okay.
So make sure you spend about 5 minutes taking those case notes and putting them into a structure in your letter, even thinking about how you can use any templates you might have learned in terms of conveying that information as effectively as possible.
Yes, note form, write out, giving. Of course, it's going to vary from letter to letter. We can't say, has to be this way. It's going to vary from letter to letter. So you're just going to analyze your structure on the day.
Yeah, precisely.
And then formatting the letter as well. So, and just to point out again, planning is so important. I know a lot of students don't like to plan, but make sure you do it. Then formatting the letter as well. So this, of course, you're trying to make this like a real professional letter.
So you actually need to write it like it is a letter.
Yeah.
Remember, communicative purpose is essential. You need to actually write this letter as closely simulating a real referral letter as example. So you can't obviously just write down your main information. You have to actually write it like it is a letter. So you need to include the essential information such as the address, the date, the greeting, the reference, which often will include the patient's name and their date of birth. And then, of course, you go into your main structure as well. But make sure you actually write that letter heading information, typically on the left-hand side of the letter as well, including that information.
Yeah.
And like a letter as well, you need to also structure it well, including an introduction, your main body paragraphs, a polite ending, and then also the formal sign-off ending at the very end, yours sincerely, yours faithfully, followed by your name. So
Definitely.
yours sincerely will follow if you know the name of the healthcare professional you're referring to. Yours faithfully will follow on from the name if you're actually just referring to any generic doctor overall.
Very
or
good.
nurse, for example.
Yeah, okay. So what about the introduction then?
So the introduction is essential. This is really where you hammer down on the purpose of the letter. You need to actually start off by communicating clearly exactly what it is about this patient that you want the relevant professional to do. So we can divide the introduction into 3 different sections. They are the purpose, the main health issue, and then the request.
So, for example,
a sample introduction can be the following. I am writing to refer Mr. Smith, that's the purpose, I'm referring them to you, who has been diagnosed with COPD, that is the main health issue, for your further assessment and management, the request, what I want you to do. So that would be a simple introduction, which you can maybe flesh out a little bit more if you wish, but it gets the point across about what this referral letter is trying to do, and you will score well on your purpose if you do something like this.
Yeah, and of course you need to consider at that point if it is urgent. If the letter is urgent,
point,
then perhaps you're going to refer to I am writing to urgently refer. Okay, so you're going to point that out and make that clear if it is urgent, which you will have noted, of course, when you analysed your case notes. And then the main body paragraph. So, of course, this is going to differ from letter to letter, from situation to or scenario to scenario. So you're going to just talk through like a general layout that for a general referral letter that we have seen.
And they often include the following information that we're going to discuss
Exactly.
in one way or another, but obviously it depends on which parts you think are most essential for the referral of this patient.
Yeah, so the first one could be the most recent information. So perhaps you've seen that patient today and you're going to be referring to how they seemed or any symptoms that they had throughout that examination you had with them. Then, secondly, you're going to have a summary of the previous case presentation. So maybe previous appointments that they had with you, perhaps.
Or what's happened previously in the healthcare as well of them. That's all very important.
History, yeah. And then maybe social history.
Medical history as well.
Yeah.
So there might be some extenuating circumstances which has been joined on to the current patient's healthcare predicament. So that's obviously can be essential to include, as well as any societal information that might be important as well. It's up to you to decide whether that's relevant or not, depending on the situation of the letter, but often it can be included to some extent with some information in the case notes.
Yeah, and then your outcome, of course, what you want the reader to do. So really summarising for the reader so they go away clear, knowing what it is they have to do with this patient.
That's important, all right.
Yeah. So just overall, make sure that you make the reading experience easy for the reader. So how are you going to do that? Well, that all comes down to your structure and your organization and how well you link your language together. So throughout the letter, you want to make sure that you use the dates, that you use linking words and any linking phrases to make your letter cohesive overall. So every paragraph should begin with either a date or a linking phrase, for example, on examination today, something like this. Okay, so really making it clear exactly what your paragraph is going to be about overall. Paragraph 1, for example, today the patient was admitted. Paragraph 2, the patient first presented on the 14th of the 12th, whatever it is. And paragraph 3, in terms of the patient's medical history. Paragraph 4, in view of the above.
So these all just pretty much highlight to the reader about what is coming next in the paragraph, and it also uses formal medical letter writing discourse as well. So that's very important.
Yeah. But it is important to make sure, and I think this can be easily done, not to overuse transition words. And that's one of my, like, when I read a letter and I just see transition words like firstly, secondly, on the other hand, all over the place, it's actually off-putting, and I don't.
It's also too academic as well,
Yeah.
and it wouldn't be actually replicate a real medical request
Yeah,
letter, for example.
too many transition words. So really avoid that. Only use linking words when you want to add something really different or you want to show obvious contrasting piece of
appropriate.
information.
But that also means that you shouldn't obviously be using simple sentences because you can't use a linking word. You should be using complex or compound sentences as well. But really just think about, is that linking word essential? Is that conjunction essential for the overall meaning and tone and purpose of this letter?
Yeah, exactly. Ask yourself that question. Is it essential?
It's important.
Yeah. Okay, so then shall we just leave students today with some tips on things that you can do overall and just some things that you need to remember.
Yeah. What's the first tip you'd recommend?
Just in general, avoid common language mistakes and make sure that you're working on your language mistakes and your grammar and your vocabulary and your spelling. Because especially with this kind of writing task in this exam, students have a tendency to just get bogged down in writing letter after letter after letter. They just think, I just need to keep writing, I just need to keep analysing case notes. Yes, but you need to make sure that you are actually working on your language skills too. You know, that you're working on simply writing complex sentences, compound sentences, and that when you do get feedback, like we said at the beginning, you actually take on board that feedback.
Yes.
And really make sure that you, for example, if you write a letter, on a Monday and then get your feedback, maybe just take the Tuesday to actually just focus on some of the grammatical mistakes that you have made. Maybe you need to work on your articles. Maybe you need to work on your passive voice, because instead of getting into writing another letter.
These do take time to improve upon. Simply by reading a reflection sheet is not enough for you to actually take in the information on board and make those corrections. We emphasize quality over quantity. This is actually a learning process. You need to obviously put in the work to ensure that you are improving consistently across this task.
Exactly, yeah. Yeah, so avoid common language mistakes. And that all comes down to being a better learner, studying more efficiently and effectively. And, like we said, like making vocabulary lists, practicing your spelling, just that overall active learning of the English language.
Also, what you need to do on the day of the examination, as well as in your own time, is practice under writing conditions that are replicated in the OET examination. So you want to ensure that you were able to write this letter effectively within the 45 minutes of time that you have. If you're spending an hour and 10 minutes, for example, doing it, then you're just not ready to, unfortunately, write the letter under time conditions. So when you are writing, make sure you replicate the OET examination as much as possible. Take 5 minutes when reading the case notes just to read over them. Don't start writing at that point. Take 5 minutes then to start writing out your plan. Obviously, extract that key information, who the patient is, what their main condition is, who I'm referring to, is it urgent, etc. And then start taking out your main case notes, highlighting notes, removing the unessential information, and then start to think about your structure of the letter. Write for 30 minutes, and then remember to spend 5 minutes at the end also reviewing your letter as well, making sure it flows well. Are there any grammatical mistakes, any typographical mistakes, any spelling mistakes? Oh, I've used too many cohesive devices there, I shouldn't have used that, etc., etc.
Yeah.
So make sure you do it within 45 minutes.
Definitely. Okay.
And then I guess we'll end with just one final point about in preparation for the OET examination. That is, be realistic with yourself. The OET examination isn't easy. It is fairly difficult, and the writing task is obviously an example of that overall. So be realistic with yourself. Make sure that when you're doing the OET examination that you have set a realistic date for you to complete it. It is also not cheap as well, so you want to ensure that you are ready on the day. It can be very demoralizing when you've spent a lot of money doing an examination only to not pass it and then have to go through the process again.
Yeah, so only put yourself through it if you feel like you're ready, you've been getting consistently, the scores that you want, and perhaps you've been told by a teacher that you're ready as well.
That's also a valid point as well. It's therefore important that you actually do have feedback from an OET professional or a teacher of some sort to just actually indicate to you if you're ready or not, because you want to ensure that you are obviously using your time effectively and also your hard-earned money well. You don't want to have to repeat the examination again. So they can actually give you a clear indicator about when you can do the test and when you are ready.
Okay, guys, so I hope you got some really good tips from our podcast today. And of course, that you can go away and put this all into practice and get studying for your OET exam.
Wish you the best of luck with OET writing and the OET test in general. Thanks for watching.
Bye-bye.
Bye.